If you are over 65, I need you to listen carefully to this. The first sign of vascular decline does not appear in your chest. It often appears somewhere else. And most men dismiss it, not because they are careless, but because no one explained what it really means. What you are noticing now did not begin recently. It has been developing quietly for years inside your blood vessels. And here is what concerns me most as a doctor. By the time the symptoms feel obvious, the process is already advanced. I am Dr. Ananya Rao, a urologist who has worked with men over 60 for more than 15 years. Every week, men come to my clinic confused. They say, "Doctor, I feel fine, but something is different." Today, I am going to explain exactly what that something is. Not emotionally, not dramatically, but medically. After the age of 65, your blood vessels begin to change in a very specific way. The inner lining of your arteries, called the endothelium, slowly loses flexibility. This is known as vascular stiffening. And here is the part most men never hear. You do not feel this happening. There is no pain, no warning sensation. Your circulation simply becomes less efficient. Blood moves more slowly, oxygen delivery reduces slightly, recovery takes longer. And because this happens gradually, your brain adapts. You lower your expectations without realizing it. You may notice your erections are less firm. Morning erections disappear. You need more time to respond. You feel more tired after simple activities. Your hands feel colder than before. Small cuts take longer to heal. And here is the key point. These are not isolated symptoms. They are connected. They all point to one system, your circulation. And when circulation declines in one area, it usually declines everywhere. Now let me explain why this matters beyond intimacy. This is the part many men misunderstand. Sexual changes after 65 are often the earliest visible marker of systemic vascular aging, not because intimacy is fragile, but because that system requires rapid, high-volume blood flow. If your blood vessels struggle there, they may also be struggling around your heart, around your brain, around your kidneys. And here is what research now confirms. Men who develop erectile changes after 60 have a significantly higher risk of cardiovascular events within the next 3 to 5 years. I am not saying this to frighten you. I am saying this because early detection changes outcomes. Your body often whispers before it screams. Reduced firmness, reduced stamina, reduced sensitivity. These are whispers, and most men ignore whispers. Now here is something important. This process is not a sudden disease. It is vascular aging. But when vascular aging accelerates because of unmanaged blood pressure, high cholesterol, diabetes, inactivity, or chronic stress, it becomes dangerous. And the most dangerous part, you can feel completely normal. No chest pain, no dizziness, no dramatic symptom, just subtle changes. This is why cardiologists today consider erectile dysfunction a cardiovascular risk marker. It is not separate. It is not embarrassing. It is biological information. Your body is providing data. The question is whether you are listening. Now let me give you control, because this is not a hopeless situation. Vascular health can be measured. Blood pressure can be managed. Cholesterol can be controlled. Blood sugar can be stabilized. Physical activity improves circulation at any age, even after 65. And here is something many men underestimate. You do not need to reverse decades of aging. You only need to slow further decline. That alone dramatically reduces risk. When men understand this, anxiety decreases. Because now the issue is not, "I am failing." The issue becomes, "My circulation needs attention." That is manageable. That is measurable. That is actionable. Now I want to speak directly to you. If you are over 60 and you have noticed these changes, do not ignore them. Not out of embarrassment, not out of pride, not out of fear. Information at this stage of life is protection. This channel exists specifically for men in your stage of life, not for teenagers, not for young athletes, for men who want clarity, for men who want to protect their health intelligently. If you value calm, serious medical guidance without drama, subscribe now, because in the next video, I will explain the one specific medical test every man over 65 should request and why many doctors do not automatically order it. It is simple, it is measurable, and it can predict cardiovascular risk years before a major event happens. At this stage of life, prevention is power. Subscribe, and I will see you in the next video.